All right, I think we're actually up and running right now. So, thanks for everyone for your patience there and for joining us. Something great about having great live broadcast is that you never know what to expect and what's coming up, and so we're glad to be here. Looks like we're up and running now. So again, this is Medicaid Matters, Tuesday, November 13th, 2012. I'm your host, Richard Yaden, and we're coming to you live from our studios here in Brentwood, Tennessee, just a stone's throw from the capital, the healthcare capital of the U.S., Nashville. Well, on deck for the next hour, and we're going to be covering a lot of territory here over the next hour. Some of the things we're going to be talking about: a $200 giveaway. We're going to talk about the top 10 reasons why you should meet me in Orlando this February. We're going to have a report from the Achieving Excellence in HEDIS Measures and Quality Management Conference. And then I'm going to go through the top 5 things I learned at that conference where I was yesterday. We're going to have a very short conversation and some remarks from Amerigroup National Medical Director for Provider Collaboration, Dr. William Runyon. And I've got a thought about the election that I want to share with you if we get time for that. So you see, you have arrived at the right place at the right time and for all the right reasons. You want to be up to date and in the know about what's happening in Medicaid today. And if you're part of our regular audience, then you know this is the place for relevant, timely, and insightful information about the business of Medicaid health care. Today we're going to cover a lot of topics. It's just one short hour, but I would like to hear from you during today's show, especially during today's show, because we're going to be covering so many things. It would be great to get your input on that. We're ready for your calls now. The number is 626-657-2125. That's 626-657-2125. You can speak with me right here during the show, comment on anything that I'm talking about. Let us hear your opinion. Let us hear your comments on any of the subjects we're covering today, because that's what makes this show great, is the fact that we're interactive. If for some reason you can't actually call in, we can fix that. We're also on Twitter, and you can send a comment or a question to Medicaid Talk on your Twitter account, and we'll get them on the air as time permits, and feed those into the show. And we're still getting our regular chat feature operational on our new website. But you can send me an instant message right here during the show. We are up on Skype and available to do that. If you're not already connected with me on Skype, just send me an invitation to Medicaid Talk, and we can have your comments, and you can IM me a question or a comment during the show, and we'll certainly get that on the air. And also a great way for you and I to stay in touch even when we're not on the air, because I'm up on Skype all the time, every day, and we'd love to get your comments and connect it that way. Well, yesterday I was at the Achieving Excellence in HEDIS Measures and Quality Management Conference being held right here in Nashville. And while at the conference, I had an opportunity to personally speak with some of my clients and some of my colleagues and associates that are from the New York City and New Jersey areas. Believe me, they are still dealing with the impact of Hurricane Sandy. And while it may have faded from the news a little bit, it's no less of a serious situation on the ground there. I was having lunch yesterday with someone who had been without power for 11 days and just got their power back yesterday. So I want to encourage all of you that are watching the show today or that are listening, make a donation to the American Red Cross or whatever your favorite disaster relief organization is. It'll go a long way in helping those that are affected by Sandy. There's still a lot to do, and your support and your donations will do a lot if you can make that. So make it a priority. All right. Now, I mentioned at the beginning of the show we're going to give away $200. Well, it's not quite $200 or 200 real dollars, but it's $200 value. So have I got your attention? And so hang on. I'm going to give you some information in just a minute about how you can make use of $200. So get ready to write or type, whichever you prefer, because you're not going to want to miss this. I have been invited to be the chair of the Medicaid Innovations Conference in Orlando this coming February. And if you go to MedicaidTalk.com, you're going to see a link to the conference, and you can get a lot of information that way. But we were at the conference last year. We did a live broadcast of one of the panel discussions last year. You can go through our archived lists of shows, and you can see that panel discussion in case you missed it. And the discussion is typical of the quality of presentations that are slated for the 2013 conference. Now that the election is behind us, those of us who work in Medicaid are going to have to think about how to do things differently, how to do things better and more efficiently. And if I've heard anything from our clients and from guests on this show, it's that innovation is the name of the game going forward for the business of Medicaid. And that's exactly why you need to consider attending this conference. If you want to hear about the latest innovations, the most effective best practices or newest best practices that are being established in the business of Medicaid healthcare, then you really do need to come and join me this coming February at the Medicaid Innovations Conference in Orlando. Now, in fact, there are 10 reasons why you should be at the Medicaid Innovations Conference. So let me talk about the first. Let me talk about the 10, and then I actually have a bonus reason why you should be there. So here's reason number 1, and these are in no particular order, but they are the top 10. First of all, the Arkansas Department of Human Services will offer a unique case study about their healthcare payment improvement initiative, focusing on why they're aligning payment incentives for delivery of high-quality, coordinated care. A great case study that you're not going to want to miss. Number 2, leaders from Emblem Health and United Healthcare will discuss health insurance exchanges and shifting thinking from Medicaid to commercial operations. Number 3, Minnesota and Colorado share their firsthand experience on establishing an ACO within their Medicaid programs. So we're going to have a little bit more on ACO, or a little more comment on ACO here in just a few minutes, something that I picked up at the conference yesterday. Number 4, WellPoint will share the key components of the quality initiative that resulted in improved HEDIS scores, including promoting preventative care, encouraging and rewarding best practices, creating a lever for medical home-based care, and improving data capture. We're actually going to talk a little bit here later in the show about initiatives that improve HEDIS measures, and you're going to hear about that and from some of the discussions I had at the conference yesterday. Number 5, Missouri Department of Social Services will address preventing and detecting fraud and abuse in Medicaid managed care organizations. Number 6, LA Care will disclose their community partnership approach by reducing unnecessary ER visits and preventable readmissions, and Ohio offers the state perspective on reducing ER visits among Medicaid beneficiaries. So you see, the conference is not just health plans that are involved. We have a lot of state governments that are going to be represented there as well. And last year, a lot of the third parties that are providing services to Medicaid health care were also included in some of the presentations, and they had a lot of great information to offer. But getting back to our list, number 7, United Health Group, the state of Michigan, and CareSource offer their unique strategies for consumer engagement. And you're not going to want to miss the CareSource presentation. We have been involved with CareSource, doing a little bit of work with them over the past several months. They have a very impressive initiative that they're rolling out in Ohio right now, which they talked a little bit about it last year, but they now have a lot more water under the bridge since they've got that launched, so I would recommend that you hear that. Number 8, Emblem Health shares how they are preparing for the challenge and opportunity for dual-eligible integrated care programs. Number 9, UPMC Health Plan will deliver a case study on how they are supporting the patient-centered medical home in Medicare And then CareSource discusses their Bridge to Home Discharge Planning Program. I had a chance to listen to a presentation from UPMC yesterday about what they're doing in the area of best practices with respect to their patient-centered medical home and improving HEDIS scores, which was very interesting. Some of the things that they were approaching, I'm going to talk about those in a little bit later in the show. And we are going to spend some time a little bit later in our show today talking about patient-centered medical home and what Amerigroup is doing with that. Had a fantastic presentation from Dr. William Runyon yesterday that I had a chance to go through, and actually had a chance to talk with Dr. Runyon a little bit afterwards. I'm going to share part of that conversation with you later in the show as well. Number 10, last but not least, I get a chance to meet you personally. And if you have been a regular listener or viewer of the show, would really, really like the opportunity to meet you personally, get your feedback on the show, what you like, what you don't like. We try to do our best here, but want to hear from you directly about how that looks. Now, I promised you a bonus reason to be going to the Medicaid Innovations Conference, and I mentioned $200, and here's the bonus. You can get a $200 discount just because you're a listener of our show. And here's how you do that. You can register to get our show updates at MedicaidTalk.com. If you're at MedicaidTalk.com right now, you'll see in the upper right hand there's a place for you to put in your email address. It's very simple. Put that in, and then we're going to send you the discount code for $200 off the conference. Now, that's pretty easy. Pretty easy to do. So make it a point to be a part of that. If you were at the Medicaid Innovations Conference last year, it'd be great to hear from you during the hour. Get your feedback on what the conference was like. The number is 626-657-2125. If you have a chance, give me a call. Would like to get your input, or tell me what you're looking forward to in this year's conference. If you go to the link on MedicaidTalk.com, you can get a complete listing of all of the presenters and the topics that are on this year's agenda. More being added as we speak, but go and check that out and make sure you're a part of that this coming year. Okay, well, I said we got a lot to cover, and that's what we're going to do here. Boy, where to start? We had so much going on yesterday at the HEDIS Excellence and Quality Management Conference, which is actually being co-located with the Transitions in Care Conference that's going on this afternoon. So we're going to jump into that here in just a minute. I think before we do that, we probably will want to go to our first break and get that taken care of first. When we come back, we're going to be talking more, not so much about the Medicaid Innovations Conference. We've covered that a lot. But I want to get to your calls, 626-657-2125. We're going to talk about some of the things that I thought were particularly interesting at the conference yesterday, some of the really interesting things that groups from Amerigroup, Inspiris, United Healthcare, Inovalon, Performance RX, NCQA, all were talking about at the conference that we're going to get to. I'm going to go through the top 5 things I learned at the conference that you're going to want to know. We're going to hear from a conversation I had with Dr. William Runyon, National Medical Director for Provider Collaboration at Amerigroup, and some thoughts on his presentation, which is very interesting regarding patient-centered medical home. And if we have time, I want to talk about some thoughts from last week's election, so you don't want to miss those. So we'll be back in just a moment. Hang in there with us, and we'll get to all of these things. Nurses who want to stay on top of their skills know that the Nursing Informatics Learning Center is the place to go. You'll find articles, tutorials, a blog, e-zine, board-approved CE credits, links, assessments, and consultant services, all available to the global nursing community in one place. If you're a nurse or if your organization employs nurses, you need to visit the Nursing Informatics Learning Center.
by providing access to the care they need and the quality they deserve. Medicaid health plans enhance health outcomes of our nation's underserved. Listen to this letter to a Medicaid health plan that helped save the life of Juan, a 4-year-old with a rare heart disease.
All of your efforts have created a miracle for my son. Even though he was so close to death, you helped. You made a difference. Now he's coming along, little by little, step by step.
Medicaid Health Plans of America, ensuring access to better health care. Learn more at mhpa.org.
Elevating the quality of care with less cost. Today, that's the job of every Medicaid managed care company, but it can't be business as usual. Companies have to coordinate care a different way. The solution is managed Medicaid services. Through our virtual case manager network, our teams of Medicaid assessment specialists, and our new advanced care transitions program, companies can dramatically raise the quality of care without increasing their cost. Visit us today at MedicaidServices.net. Managed Medicaid Services, your best source for innovative care management.
And welcome back to Medicaid Matters, the only live and interactive talk show about the business of Medicaid healthcare. Hey, take a minute now and be a part of our community. Join the Medicaid Matters Medicaid Talk community right there on our homepage. We'll keep you up to date on all the latest with Medicaid Matters talk show episodes, our future guests, events that we're going to be involved with, everything that you need to know to stay on top of what's going on. Also, when you register, we're going to send you the code for $200 off to attend the Medicaid Innovations Conference. Well, speaking of conferences, as I mentioned earlier in the show, I was at the Achieving Excellence in HEDIS Measures and Quality Management Conference yesterday, and it's just wrapping up about now here in Nashville. I was downtown there, and this afternoon they're kicking off the Transitions in Care Conference, which runs through tomorrow morning. Now, the topics presented yesterday, I was very impressed with. There were in-depth sessions, there were case studies, really on a wide array of quality management, everything including data analytics, physician and clinical staff engagement techniques, medication adherence strategies, maximizing the HEDIS STARS relationships, effective vendor selections, just across the board. And there were representatives from Amerigroup, Inspiris, United, Inovalon, which is formerly MedAssurant, PerformRx, NCQA, Emblem Health, and several others. So it was really kind of an expert focus on HEDIS measures, quality management, pushing those things to a higher level and to the bar. And, although there were, this very wide variety of topics that were there, it seemed that there were 4 major themes that were being discussed. And almost every presentation touched on one, if not 4 of these themes as they launched out and went in through their material. The first one that I noticed, the first theme that seemed to be permeating throughout the entire conference was a theme of an aggressive movement toward a more robust integration of community-based resources and programs. Now, I've heard this theme at a number of other conferences, and certainly some of the guests that we've had on the show have brought this up. It seems like everyone is really working hard to integrate the community resources into their program. Dr. Stephen Perkins, who's a VP of Medical Affairs for UPMC, spoke about this in his presentation, which was on creating a cohesive plan to improve scores on HEDIS measures. Now, their care approach is more member-centric and becoming less and less case manager-centric. For instance, they appear to be reorienting their entire care management program around these community-based resources. I took a few notes from what he said I thought was interesting in this care management approach. First of all of their new programs that they're establishing, all of their new resources that they're establishing are being moved away from the health plan and centrally located, or I guess you should say dispersed into these community-based resources. They have really invested heavily in having what they call mobile outreach representatives. They have aggressively implemented a doula program into their care management approach. They also have a very aggressive flu shot campaign for their high-risk members. And they have mobile vans that are going from different community segments that is being coordinated with the primary care physicians in that community. So that community-based theme showed up in a lot of the different presentations that I listened to, and is certainly a growing trend throughout all of Medicaid as well. But they're actually seeing a correlation, and I don't have time, in the hour we have here, don't have time to go through all of that, but they're actually seeing a correlation between this community-based emphasis and the increase in their HEDIS measures, the increase in their quality scores as well. Now, the second thing I noted is something that we're hearing off and on as well, but was really hammered, really brought home in a big way at the conference, and that is the need to do things very differently than what we've done in the past. Now, this was echoed in almost every presentation that was given at the conference. Now, the way things have been done in the past, and I think most of our audience would agree, probably just isn't sustainable going forward. Certainly going forward in the future of healthcare reform and what's coming down the pike. And this is being driven not only by changing regulations, which we're, of course, all dealing with, but it's also being driven by the very real, the very practical need that all Medicaid organizations have, and that is to operate more efficiently. If you go back and listen to almost every show that we've broadcast over the last 18 months, you're going to hear this same theme throughout the show. And it's not just applicable to Medicaid. This is something that we're going to hear throughout our entire healthcare system. In fact, right here in Nashville this Thursday is the 2012 Healthcare Investors Conference. And the main topic in that conference is how to change the way healthcare is being delivered in our country. So, if the money people, if they're starting to talk about, hey, we've got to do things a lot differently, a lot more efficiently, then this is something that that we all need to be listening to and getting on board. The third major theme in the conference was the absolute need for a much closer collaboration between payers and providers. Now, this is something I know that is talked about all the time. We have to work very closely with the providers, or the providers are saying we need more cooperation from payers. I mean, this is something that's been talked about for years and years. What struck me at the conference, though, in relation to the need to improve HEDIS measures, to trying to improve quality, what struck me was that the absolute need, the passion with which the presenters were talking about how important this was to changing and improving the quality of the health care they're delivering was perhaps more striking than what I've heard in the past. And I'm going to have more to say about this later when I talk about the patient-centered medical home program, but it was very clear that the payers and the vendors at the conference were aggressively moving toward providing a more hands-on approach, at least to the extent of helping providers better understand the cost and quality measures. And when you think about this, I mean, this really makes real sense. It is the essence of what we're going to need to make happen if the patient-centered medical home concept is going to be dramatically effective, which I think is what everybody wants, and I think there's a lot of emphasis, there's a lot of momentum behind the patient-centered medical home, and a real need for that to work. So finally, the fourth major theme at the conference, and again, this conference was all directed at initiatives, programs, ideas, best practices at improving and sustaining excellent HEDIS measures, excellent quality management. The fourth theme was the concept of engaging everyone in the organization, not just Medicaid, everyone in your organization with achieving that goal. I was particularly impressed with what Kathleen Harkness, who is a senior director of corporate quality at Midwest Health Plan, had to say, and with what she does at her organization. It was certainly the most entertaining presentation of the day. It included Mexican hats and maracas. You'll have to ask her about that. That's about as far as I'm going to go into it. But they have really made this a hot topic. They've made this a top priority through all levels of their employees, from senior management right down to the receptionist. And it includes things like, getting everybody in the company involved in quality. Engaging employees is what they talked about. They do things like what they call a annual family reunion, which is a company-wide gathering. Now, they're a smaller company, she said, I think about 100 employees. But they get everybody together at one time. There's food. It's a theme-based type of event. They get to take home some type of trinket that is associated with that theme, and they go through all of the achievements, all of the benchmarks, everything that has to do with improving their HEDIS measures and their quality management. Every employee receives a complete review of that, of HEDIS, of CAP scores. They get taught on what they mean and why that they're all important, and what their particular job does that impacts those scores. So pretty impressive presentation and focus that they have. So what are the experts talking about? What are they doing to achieve excellence in HEDIS measures? What are they doing to achieve in quality management? Well, it would seem that they're all focusing their efforts around four main themes: robust integration of community resources, looking for new, more effective and sustainable ways of doing things that they're doing now, strongly coordinating payer-provider collaboration with respect to how to use the data that's being delivered to providers, and engaging all employees at all levels in achieving HEDIS and quality goals. So four themes that were resoundingly presented over and over at the conference, and I would suspect that your organization is probably involved in some of those in some way as well. All right, well, as I said, we got a lot to do here. Let's get to before we get to that, it's time to take another short timeout. When we come back, I am going to take a few minutes and talk to you about what Dr. Runyon had to say. We're going to talk about his work he's doing with Amerigroup and their patient-centered medical home program, and how that is so integrated with provider collaboration and their work to try to improve the HEDIS measures and their quality scores as well. So you don't want to miss this. And then following that, if I have time, we're going to get into some thoughts about the election and what I'm hearing from everyone out there as well. So stay with us. We're going to be back in about, I would say, 2.5 minutes, and we're going to get into all that. Lines are still open, 626-657-2125. Give us a call. Love to hear your comments on any of these things, especially if you're doing something innovative in your organization or your company's doing something innovative with respect to improving HEDIS measures and quality management. Would be good to get that real-world experience from you. So give us a call, give us a IM, send us something on Twitter, and we'll get it on the air. Look forward to hearing from you. Medicaid Matters is now booking guests. Who are we looking for? We're looking for people who can bring a fresh and unique perspective to the business of Medicaid health care. Do you have an idea that is unique, innovative, maybe even controversial? We want to hear from you. Go to MedicaidTalk.com, complete our guest questionnaire, and we'll be in touch with you to schedule an upcoming episode. Be a part of Medicaid Talk.
The Medicaid landscape is changing fast, and that means challenges, but it also means opportunity. Opportunity for you. And that's why you need to visit MedicaidJobs.net. MedicaidJobs.net is the place to showcase your talent to Medicaid companies, search for jobs, research the latest career trends, and register for the free Career Optimizer service. Don't wait. Go to MedicaidJobs.net today.
You're listening to Medicaid Matters on the blogtalkradio.com network. Hey, the season is finally upon us here in Middle Tennessee. You know, last night was the coldest night here since this past February. Today is very chilly, so November has arrived, and it is certainly cold. But you know what's really hot right now? This show. You know, almost 70,000 people have listened to this show, and there is no better way for you to reach the Medicaid business audience. I want to invite you to join our show as a sponsor of Medicaid Matters. There are several options that you can choose from to fit your needs. Just email us at info@medicaidservices.net, and Charlotte will get in touch with you to see how we can help you get your message out to the Medicaid business community. All right, so back to what we were talking about, the experiences I had at the HEDIS Excellence in Quality Management and Medicaid Innovations. I want to talk about a particular presentation I sat through that I thought was very well done, but also had just tremendously interesting and I think powerful information. If you get a chance, you should check this out by getting in touch with Dr. William Runyon. But, you know, how do you, when you think about patient-centered medical home, how do you really transform a primary care practice into a patient-centered medical home? And why would that be necessary? Why do you need to put effort into transforming the practice, which is a key word in what I'm going to talk about here? What impact does this have on HEDIS measures and on quality management? Well, there was a quote in the Wall Street Journal, I think it was a few months ago, that went something like this: healthcare quality has become more about completing audits than it has improving the quality of a patient's health. Now, I'm going to tell you right now, that's a bad paraphrase. I looked all over for the exact quote. I remember reading it. And if someone has the actual quote, please give us a call with it before the end of the day. I'd like to clear that up. But, you know, we have data. There's no question about it. We're collecting data in Medicaid left and right, all different types of collection points. We've had some people on the show talk about how the data is not always useful because these collection points are often siloed. But how can that data get to the doctor who's actually seeing the Medicaid member? And how can that data help the doctor make better decisions about that member's health? And that really is the key. Well, Dr. William Runyon, National Medical Director for Provider Collaboration with Amerigroup, gave a passionate presentation about how their patient-centered medical home program is working and believes that they may have found a path to answering some of these questions. Let me go over a few of the main points that he talked about. First of all, they had a very interesting way that they qualified the providers that they were actually going to work with and spend time with. Now, they had a whole set of criteria, but let me give you the top three criteria. Number one, when they're looking at a provider that they want to collaborate with, the first thing that they're looking at is that provider willing, and do they want to collaborate to make a transformation from just a primary care practice to a patient-centered medical home. So that would move, that's the number one criteria that they're looking for. Number two is they're looking for the density of members within that practice as a percentage of that practice's patients. And then the third type of criteria that they would use is the strategic location of that provider. So they're taking a very thoughtful approach, not just trying to take all of their primary care providers and move them into a patient-centered medical home, but really thinking through which providers make the most sense strategically and from a resource standpoint. Now, Dr. Runyon talked about a report that was published in 2011, and I didn't catch the reference. I'm sure I could find it. But the report talked about the common characteristics that are involved and present in bending the healthcare cost curve, and there were two pieces in that report that came out, which I think is what's driving their interest and their very proactive, hands-on way of helping these practices transform into patient-centered medical homes. The one characteristic was there was a close collaboration between health plans and providers. And the second characteristic, which is why this was part of the conference, is that you have to provide the providers with the quality and with the cost data. So if you've got those, this report is saying if you've got those two things working for you, then you've got a great chance of bending that healthcare cost curve. So the what, as he was saying, the what of what they're trying to do is providing regular basic reporting to the providers, and how they're doing that is they're facilitating the practice's ability to use the data to improve quality and cost measures. More than one speaker talked about specific instances that they were aware of where providers were given either given spreadsheets or mailed reports or whatever it might be of a lot of HEDIS and quality data, and frankly, the provider just threw the stuff away. Not because they weren't interested, not because they didn't value it, but because they just didn't have time, the resources, or maybe even the expertise to pour through the data and really understand what that was telling them. And we're going to talk about that here. And I brought that up in a somewhat of a roundabout way when I talked to Dr. Runyon, which we're going to hear in just a moment. One of the things I asked him, though, was why did Amerigroup feel that the patient-centered medical home program required such an intensive of effort and why they put this at a high priority on their list. And he talked about three things. One, that there was evidence going back to 2001. The Institute of Medicine issued a report that talked about the quality chasm and talked about the importance of redesigning our healthcare system and the importance of primary care in that redesign. He also talked about Barbara Starfield promoted the thought that the evidence of more primary care intervention led to higher quality. And the third reason was that primary care practices just can't transform on their own, that they need to have a lot of support. There's been some national demonstration programs that have been done by the American Academy of Family Physicians that really highlighted this, that without a lot of hand-holding, without a lot of direct support, it was very difficult for providers to make that transformation. So let me play a segment for you here of the conversation I had with Dr. Runyon after his presentation, and he's going to talk about three things in here that I think you'll find very, very interesting. Here's Dr. Runyon.
Hey, during your presentation, you made a comment. You can't hire enough case managers to bend the healthcare cost curve. Tell me a little bit more about what you mean by that.
I think it has a lot to do with some of our traditional managed care approaches to managing particularly the high-risk patients. And if we think conceptually about how managed care has done business for years, and we can hire a cadre of perhaps 20 to 30 case managers and quite typically isolated within the confines of an office, making outbound calls to members, trying to manage them telescopically. And if we think about how to effectively engage with members, who's better positioned to do that. So if you compare 20 to 30 case managers to perhaps 150 primary care physicians who are much better positioned to engage with those members, really address their self-management needs, and the whole host of issues that come across for those patients that have multiple chronic conditions, we're really not ever going to be in a position with a managed care organization to bring on board enough case managers to do that kind of work.
Yeah, it's a huge workload, and I think, you know, from what I see Amerigroup doing and what you were talking about in your presentation, the integration of all the different parts seems to go a long way in getting you closer to where you want to go. Wouldn't you agree?
I would totally agree, and I think it brings us ultimately much closer to our members than to continue along those same traditional courses.
Yeah, no question. You are very involved in Amerigroup's Patient-Centered Medical Home program. Your presentation was very comprehensive in just demonstrating what the program is doing and the thought process behind the program. Tell us a little bit about some of what you would say are the more dramatic results you're seeing as a result of people being in the program.
The result I like to focus on probably most frequently, it relates to one of our first patient-centered medical homes, been in the program the longest. It was a large practice of ours, and this is a practice who in year one was in the bottom quartile of our quality results. After we'd been working with the practice for a year, this particular practice moved from the bottom quartile to the top quartile in their quality results, and also significantly reduced the number of ER visits, dropped their ER visits by about 10 to 20%. And so with that being a practice that was in the program the longest, the one I like to reference the most, and we've seen some early promising results with some of our other practices as well.
What do you think attributed, or were there any certain components of the program you think that really drove that particular practice to the higher levels?
I think probably the most significant thing we look for in our primary care practices is a leader, and hopefully a physician leader that's dedicated to the concepts of a patient-centered medical home and really wants to dedicate the time and the resources to making sure it's successful. And that was true for this particular practice. We had a physician leader who was passionate about bringing his practice around and becoming a patient-centered medical home, and I think that's ultimately what made the difference.
Well, certainly in the presentations we've just seen this morning, I think the issue of close collaboration with the practice and the health plan is a key ingredient to making this work. You mentioned in your presentation also that you felt primary care had fallen into a state of disrepair. Tell us a little bit more about what you mean by that.
Well, and I don't think it's necessarily the fault of the profession itself, other than it didn't really keep an eye on where the primary care professions were going. But if we think about where the emphasis has been placed the last few decades around the training of physicians and what makes practicing medicine attractive, it certainly has brought particularly new physicians more into the realm of practicing specialty than it does primary care, and really has tied greatly to our system of reimbursement is that we continue to reward to a much greater degree those who are practicing specialty medicine than we do for primary care. We also continue by our reimbursement systems in a fee-for-service methodology reward volume. And so it increasingly puts the primary care physician, particularly because of their low reimbursement, on a treadmill of cranking out visits and not necessarily paying attention to the outcomes. And so the rewards they hope to achieve from medicine when they first enter the field quickly dwindle away, and burnout is a tremendous risk. And so really puts the profession at risk unless we continue to pay attention to putting them back into a profession where they feel they're reaping the kinds of rewards they desired from the get-go.
Great. Well, thanks for spending a few minutes with us.
Sure, Rick.
And that's Dr. William Runyon, who is the National Medical Director for Provider Collaboration at Amerigroup. It's real interesting to hear what they're doing, and I think if you go to the Achieving Excellence in HEDIS Measures and Quality Management website. They may have some of these presentations up there for you to look at. Last thing I wanted to mention about what he was talking about and how much they have really invested in this close collaboration is that they have a position that they've created and that they staff for called the Medical Practice Consultant. And this is an expert on data analytics, an expert on HEDIS and quality, as well as someone experienced in practice operations. And this is the person that liaisons directly with the physician and helping them make this transformation and helping them use the data and the analytics to make the transformation and actually use it as a tool to improve care. All right, well, we're going to take our last break here before we get to the final segment of the show. If you've been waiting to join the conversation, now's the time to jump in. 626-657-2125. Let's hear from you. I hope you're enjoying today's show, and I want to remind you that opinions and viewpoints expressed by guests on the Medicaid Matters Talk Show are not necessarily those of the host or our sponsors. Thanks for listening, and we'll be back in just a moment.
Every 19 seconds, a child will die because of a lack of clean water. It is estimated that more than 80% of childhood diseases and deaths in underdeveloped countries are a direct result of drinking contaminated water. During the course of this commercial, 3 children will die. You can help make a difference in the lives of these children. By supporting Healing Hands International, you will provide safe, clean drinking water to families and villages around the world. Since 2006, Healing Hands has drilled more than 400 water wells in countries like Haiti, Ethiopia, Zimbabwe, and Honduras. Through the help of people like you, we have been able to bring the gift of clean water to more than 1 million people. To learn more about Healing Hands International and what we are doing to help, visit www.hhi.org. With your help, we can continue this life-saving work and make a significant difference in the lives of children.
And welcome back to the final segment of today's show. This is Medicaid Matters, the only live talk show about the business of Medicaid health care. Thanks so much for joining us today. If you want to jump in with a question or a comment, please do. We have a few more minutes left here, about a little less than 10 minutes, and we'll want to talk to you. Well, after spending a day most of the day actually, with the managed care experts of excellence in HEDIS measures and quality management, you'd think that I'd probably learned something, and you would be right. There are maybe 5 things that I learned. Well, I should say there are a lot more, but these are the top 5 things I learned at the Achieving Excellence in HEDIS Measures and Quality Management Conference, and these are in no particular order. But they are the things that stuck with me and struck me, and the things that I think that any of you could take away from the conference. First of all, if ACOs, I know we were talking a lot about patient-centered medical homes, but if accountable care organizations are going to really deliver the savings that are advertised, they're going to have to learn to deliver care more efficiently, such as making much better use of health information technology. This came from a presentation that showed that, yes, there were some savings from the ACO, but that the startup and support costs of the ACO were so large that really kind of swamped any savings that they saw. So they were going to have to do a much better job of using their health information to make it happen. Second thing I learned is the key to radically improving HEDIS measures and quality management is to get everyone involved in the organization. Employee engagement is the name of the game. I mentioned a presentation where a company had really invested into this. I know of another company in Michigan that has done the same thing. But this company invested so much in employee engagement that they moved their ranking in their the Medicaid health plan was ranked in the U.S. News and World Report 3 years ago at number 42, and they took this whole issue of employee engagement 3 years ago. They infused the need and the whole message of improving quality throughout the organization, and 3 years later they've moved from 42 to number 12 on that report. So something to be quite proud of. Now, HEDIS, H-E-D-I-S, we all know what that stands for, but I actually learned it stands for something else, and this is the third thing I learned. HEDIS, H-E-D-I-S, really stands for Hell Every Day in Spring, which, of course, that was delivered somewhat tongue-in-cheek at the conference, but I thought that was interesting because we all know what we have to go through, or what you have to go through in spring when it comes to that. The fourth thing I learned: don't just dump data on docs. You have to give these physicians very proactive, hands-on help in using data as a tool to improve outcomes. And then the fifth thing I learned was to hire specialized people to help these providers understand the data and how to use it. At Amerigroup, they call them medical practice consultants. Doesn't really matter what you call them, I guess, but the key here is that if you're going to collaborate with the providers, you've got to give them more than just data. The entire conference talked about the need to collaborate in a very hands-on way, and that was really one of the keys, one of the themes I talked about earlier, and something that I learned that has to be done if you're going to move those scores forward. So a lot of things went on at the conference. I hope that recap is going to give you a good flavor of it. I would encourage you to investigate it. We're going to have a link there at MedicaidTalk.com for you to get in touch with the organization that puts the conference on. And I've got a few more things I want to write about that came out at the conference. So be checking our blog at ManageMedicaidServices.com to hear more about that. And certainly sign up for our list here on MedicaidTalk.com. Well, before we finish here, I want to leave you with some thoughts on the presidential election. It's just too big of an event in many ways, and in many ways it wasn't really much of an event. But I didn't think that we could leave it. We talked a lot about this, the ramifications that would happen if Romney won or if Mr. Obama won, all of those things that we talked about on the show. So I thought it'd be appropriate for me to share a few thoughts with you about this before we finish today. I'm first of all, I'm very thankful that it is past us now. And there's no question that the presidential election is a very important function of our republic, but it's also a tremendous distraction from what we all get up to do each morning, and that is to improve the health of the people that have been entrusted to our stewardship. So just from the standpoint of it being a distraction, of it being rancorous, of the uncertainty that it creates, I'm really glad it's behind us. And the other thing that we have to note, though, is that as a country, we have emerged from this election cycle probably as politically divided as we ever were. I'm hearing things in the news now about states that want to secede from the union and all this other stuff, which is just a lot of distraction as well. And I certainly understand where it's coming from, but there is some uncertainty, no question, even with the re-election of President Obama. But there is some certainty. There is certainty that we can move forward with. If you think about it, on the morning before the election, we all woke up, and the challenge for Medicaid businesses was to improve the outcomes of Medicaid members, the health of Medicaid members, with a whole lot less resources than we've had in the past. And on the morning after the election, we all woke up, and guess what? The challenge for Medicaid businesses was to improve outcomes with fewer resources. So really, on this account, nothing has changed. Sure, there are some changes, and there are going to be modifications to the Affordable Care Act as we move along way, but really, that train has left the station, and I don't think anyone really thought it was going to stop anyway. So what do we do now? Well, first, we know that the same job we had before the election is pretty much the same job that we have today. Second, some of the doubt about the Affordable Care Act has certainly been removed, and the momentum already that has been gained up to this point is really only going to pick up speed. And third, Medicaid is likely to cover more people now, and we have to plan on that, and we have to find ways to do it better, find ways to do it more efficiently, more effectively, and produce measurable improvements in the health of Medicaid members. This program is going to continue to bring you the information and insight that you can use to make very real, practical and relevant decisions to do your jobs. And that is certainly a certainty that you can count on. Well, that's really all we're going to cover today. I know we moved through a lot of material. I hope it's been helpful to you. If you have a moment and have any feedback about today's show, it would be very helpful as well. You can go to MedicaidTalk.com, give us your thoughts. I read all the feedback that we get. We do incorporate that, and I would love to get it from you. We're going to be back again in 2 weeks for another show, another great show. Part of that show, we're going to have as our guest Lanita Kanoki. Lanita was just recently awarded the Managed Care Nurse Leader of the Year at the Managed Care Forum in Las Vegas. I had the privilege of presenting that award last week while I was out there. Don't forget you want to join our list and get your code for a $200 discount off of the Medicaid Innovations Conference in February.
90 seconds.
You know you're going to need a trip to Florida in February, so why don't you get registered today, and I'll see you there. And lastly, we don't have a show next week, so I want to take this time to wish all of you a happy Thanksgiving holiday. I hope you have a chance to spend it with your families. And I want to ask you all to remember, we have many of our fellow countrymen, our soldiers,
seconds.
Our sailors, our airmen and Marines who will be spending this holiday overseas, protecting this country. And please include them in your thoughts and prayers as you gather together around the Thanksgiving table. Well, you've been listening to Medicaid Matters, brought to you by the MMS Group. Today is Tuesday, November 13th, 2012, and this is your host, Richard Yaden. I'll be talking Medicaid with you again in 2 weeks. Until then, I hope you have a great day. Thanks for joining us.
Seconds. Thank you for using Blog Talk Radio. Goodbye.